So our drug is Verapamil, that's the generic name. The trade names are Kalen, Covera HS, and Verilin. And these are, or this drug is, a calcium channel blocker. It's mainly going to affect the heart and blood vessels. The direct effects are blockade at peripheral arterioles, this is going to cause dilation, and it's going to decrease arterial pressure. It's going to cause blockade at arteries and arterioles of heart. And that is going to cause increased coronary perfusion. Next, blockade at the SA node. So that's going to decrease heart rate. And then it's going to cause blockade at the AV node. And that is going to cause decreased AV nodal conduction. And this is the most important effect of Verapamil. Another effect is blockade in the myocardium, and that is going to cause decreased force of contraction. So those are the actions. Some indications are angina pectoris, essential hypertension, and cardiac dysrhythmias. The drug can be given via IV or oral. IV is used mainly for dysrhythmias. The initial dose is 5 to 10 milligrams, given slowly over 2 to 3 minutes. And then the maintenance dose is 0.375 milligrams per minute. Oral is used for angina pectoris, this Callan is given, and that is 80 to 120 milligrams 3 times a day. It's also used for essential hypertension. So Callan, and it comes in immediate release, and that dose is 80 milligrams 3 times a day. Or it can come in extended release tablets, and that dose is 180 milligrams daily. Another option is Verilin PM, and that is 200 milligrams daily at bedtime. And then it's also used for dysrhythmias, cardiac dysrhythmias. And There's immediate release or extended release options, and the dose ranges from 40 to 120 milligrams 3 times a day to 4 times a day. And some other important things to mention are its hepatic metabolism, and elimination is also through hepatic metabolism due to the extensive first pass effect.
Now I'm going to talk about the 5 main side effects of verapamil. The first being constipation, next being dizziness, facial flushing, headache, and edema to the feet and lower legs. Moving on, we're going to talk about the adverse effects being bradycardia, which is that slowed heart rate caused by this drug. Next being partial to complete AV block, which is the communication between the SA and the AV node. Moving down, there's a decrease in contraction of the myocardium, and it can exacerbate the dysfunction of severe heart disease. Some nursing implications include being cautious with patients with heart failure, seeing that it can exacerbate their symptoms. Moving on, it cannot be used for patients with second or third degree AV block. And this is also known as sick sinus syndrome. And then next, the dosage needs to be decreased in patients with liver function impairment. And this is because it is metabolized by the liver, and it should also be decreased in patients with kidney disease. Next to consider is age. For the elderly, calcium channel blockers in general can be associated with chronic eczema eruptions, so it can cause flare-ups of their eczema, so can cause and then if these symptoms are mild, it may be an indicator that they just need to switch to another type of calcium channel blocker, so a switch of medication may be suggested, but if their symptoms are severe, it's suggested that they stop using any type of calcium channel blockers. And then an indication for elderly as well is gingivital hyperplasia, so so an indication there with that would be an emphasis on dental hygiene. Another age-related consideration is that it is safe for infants and children. But it's important to mention that it is a pregnancy category C drug, and we know that that means that there's a risk for fetal death in animals, that there's been data that shows that, but there's not sufficient data for human effects, so it should be, caution should be advised for pregnant women. Moving on to education, they kind of correlate with the nursing implications that I've already mentioned. So since it negatively can impact patients with heart failure, and an important education point is that it negatively interacts with a drug called digoxin, which is another heart medication. So many patients who may be taking this medication may also be on digoxin. And also, many of these patients are also on beta blockers for like hypertension or something like that. So it's important to note that beta blockers have a similar effect in that they decrease the heart rate, so it might may cause a severe bradycardia because they are both in essence doing the same thing, so a suppressed heart rate is a possible effect from that. And then lastly, grapefruit juice inhibits this drug because drugs that are metabolized by the liver are inhibited by this grapefruit juice, so it's important that you educate the patient to avoid taking the medication with grapefruit juice.